now we're going to address the three yang meridians of the arm. And they are large intestine, triple wormer, and small intestine. And the large intestines of the the yang meridians of the arm start on the hand and end on the face. So in starting, we're going to do some nice traction. And we're going to do some compression. So I'm going to put the arm palm down, and we're just going to do some nice compressions. So come over, wait, or else you can just don't move and wait for the video. So I'm pinning here and just compressing. And just compressing. I'm going with the flow of the yang meridians, starting at the hand. Pressure's okay? Mm-hmm. And it's not necessary to press on the fist, unless you really want to, but I don't want to. This is do with the flat fist. So let's trace this. The large intestine meridian is very nice. It starts in the inner corner of the nail of the index finger. So you can just start and press into the side. And the source point is large intestine 4, in between the webbing between the index finger and the thumb. So if you move the thumb towards the index finger, you see this crease. At the top of the crease, with the pressure directed towards up underneath the index finger, is large intestine 4, and this is a Hoku point. You feel? Yeah. Me too. And then the meridian continues, it pretty much follows the radius. And it just goes like this. So it's, again, like a straight line all the way up. So you can just press into the radius. When looking at the arm, especially if you go like this, and it's a straight line this way, and right at the end of the elbow crease, in between the end of the elbow crease and the tip of the elbow, there's a hollow, and that's large intestine 11. And that's very good for elbow pain. But it also tells you that you're on track here, so you just follow the radius. And here's the elbow crease, and where the crease ends and where the elbow is, there's a little indentation. That's, again, it's called crooked pond, I believe. Large intestine 11. And then so you use that as a source. And then it comes straight up. And straight up meaning from here, it goes in between the anterior and medial head of the deltoid. So there's two points here, one at the deltoid tuberosity, where the deltoid meets and attaches to the humerus. Right at the attachment is a good point, large intestine 14, I believe. And then coming up underneath the acromion process between the anterior and medial deltoid is large intestine 15. Now these points are good for shoulder pain, as is this one, elbow and shoulder pain. And then the meridian comes over the top here, onto the side of the neck and onto the face. So it's good to have them maybe turned this away from you. And then it comes below the nose and above the upper lip and ends at the opposite side at the widest portion of the nostril. So when you look at the nostril, the widest portion, you press towards the midline, and that is the last portion of large intestine, which is large intestine 20. Welcome fragrance. Okay, so I'll be just like that video. So that's large intestine. The next one is triple warmer, and it starts on the lower portion of the nail of the fourth finger, and it comes right down onto the back of the hand, and the source point, the balancing point, is a little indentation that is just above the wrist. And if you drew a line between the fourth and fifth metacarpal, it'll bring you right to it. And I would suggest deviating the hand. I don't know if you feel that. Yeah. The source points, both for the lung, pericardium, and heart, and this source point for triple warmer are also Aikido strike points. You hit them and your hand will empty. It's called empty hand points. So if you're holding something, and here, empty hand point. From there, the point comes in between the radius and the ulna. 2 finger widths below, there's a little zigzag. But bringing your intention just between the radius and the ulna is very good. And it starts veering to where it goes in between the bones of the elbow. And then it comes straight up in between the medial and posterior heads of the deltoid. So where we're starting here, coming here for the source point, and coming in between the radius and the ulna. And then where the brachioradialis is, you sort of slide behind it, go through the elbow, and come up between the medial and posterior. And then the triple warmer comes over and comes right to just above the superior angle of the scapula, where the levator attaches. And from there, can you turn your head that way, please? It comes up straight from that point to just behind the ear. And it comes right in front of the tragus, this flap in the ear. and then it comes up a little bit and ends right at the corner of the eyebrow. If you press, you'll feel a little indentation there. It's not back here where the gallbladder is, but this is the ending of triple warmer. So it goes this way. This is the source point. Comes around between the medial and posterior head, comes just above the superior angle of the scapula, on right directly from there, up behind the ear, around to in front of the tragus, up a little bit, and right to the corner of the eyebrow. The last one, the yang meridians of the arm, is small intestine, and it starts at the lower corner of the nail of the pinky finger, and it goes into the side of the hand, following the ulna, goes through the superior tip of the elbow, and then it follows. Well, here's the source point here. So it starts here, and the source point is on the side of the hand, right at the base of the fifth metacarpal, right above the wrist. There's a little indentation, and with deviation, you can feel the point. And you follow the ulna. Here's the superior tip of the elbow. And then it comes up into the arm crease. And this is the points we worked in sideline, where you go above the crease and you come into these points 9, 10, and 11. Can you turn onto your side just for a second, please? So this is actually, you can see it clearer this way. So sideline, you can see, would be a nice way of working, but you can work in supine or prone. So here's a clearer shot of small intestine. See how it feels, that contour. And then from just above the acromion, it comes onto the back of the scapula, and it comes right above the spine of the scapula, and then it goes right to just lateral of the cervical spine, and then it comes up to just up underneath the zygomatic arch, in line with the outer corner of the eye. So if you drew a line from the outer canthus down to up underneath the zygomatic arch, that's where it is, and then it comes straight back and ends right in front of the tragus. Right, so again, small, what are we doing? It's all testing.
We just check this right now.
Okay.